My name is Dr. Francis Douglas. I represent myself and the Texas Psychological Association, and I'm testifying in support of House Bill 549. Good morning, Chair Clegg and members of the committee. Thank you for hearing this bill and for giving me the opportunity to speak to you this morning. And thank you, Representative Thompson, for sponsoring the bill and supporting mental health providers in Texas. I'll tell you a little bit more about this from the perspective of a provider, from a psychologist. Current Texas law permits mental health providers to disclose confidential information if they believe their patients present an imminent risk of dangerousness to themselves or others. However, Texas law also requires confidentiality of mental health records, which poses a bit of a dilemma to providers. House Bill 549 would resolve this dilemma. It would continue the state's permissive language for providers reporting while addressing immunity from suit to providers when they report in good faith. At least 6 states already provide this protection. And as Representative Thompson said, this bill did pass the House last year, but died in the Senate, last session, and died in the Senate. It's very urgent today that we do consider this. Again, as Representative Thompson said, requests for mental health treatment have skyrocketed over the past year, with increases in depression, anxiety, and grief, and symptoms of prolonged stress reactions. Suicide rates have been increasing in Texas for the last 20 years. We don't have data for 2020 or 2021, but we assume they'll continue that trend. More mass shootings occurred in Texas in 2020 than in 2019. And we know there were 2 mass shootings in the United States in the past week. So given all this, the clinical assessment of dangerousness is the standard of care in mental health treatment. So how does a provider weigh the need to protect their patient and society against the need to maintain confidentiality? As a provider who has had patients that had thoughts of suicide and were imminently suicidal and also successfully completed suicide, I can tell you this is a gut-wrenching experience for providers. When you have to make these decisions, you have to think about the laws, the licensure rules, your ethics, the clinical data and research on protective and risk factors. You have to think about your relationship with that patient and what reporting dangerousness might do. Will they stay in treatment, which is so important. And you also have to think about the effect of reporting on that patient's relationship with their family, with their friends, with their employer. There is a terrible amount of information that one has to think about making these decisions. So did I think about lawsuits when I was making decisions like this? Absolutely. Repeatedly, you think about lawsuits. So what I'm asking you today is to remove the chilling effect of a possible lawsuit from this already difficult decision-making process for me and for the other providers in Texas. Thank you, and if you'll have any questions, I'll answer them.
Members, any questions for the witness? Thank you for your testimony.
Thank you.